we are going to talk about some of the resources that we've been developing over the last few years. So just to acknowledge that there was a huge team that have been involved in the development of these resources. So we've been funded by the NIHR Patient Safety Research Collaboration and the School of Health Sciences Champions Network for Patient and Public Involvement. Very large team of public contributors and researchers, and then additional contributions and case studies. Some of the contributors are here at the moment. Kat, I'm going to be spotlighting you in a few minutes. So just to say, this is the tip of the iceberg, really, these resources that we've developed around patient and public involvement. We could go on for forever about different parts of involvement work, and a lot of these things have been discussed today. And the resources that we've developed are meant to be read alongside lots of different resources. They're just a kind of a starting point. We've developed a public contributor guide about patient and public involvement in self-harm and suicide prevention research. And it's framed in kind of a Q&A style. So we have things like what is research, for example. We have important issues such as pay as another, and how much we pay people. Then we have other sections such as well-being in this as well. Then this is from an idea that was from Liz about having easy read and infographic versions of the public contributor guide. And then Jane Graney, who I don't know is there today, she did a huge amount of work in developing these as well. And then we have also developed a more comprehensive kind of shared learning toolkit. So we've been doing this a long time, and we wanted to try in some way share the learning that we've had together over the last few years and put them in these documents. This guide here is kind of more comprehensive. It's designed to be accessible to everybody, but it's more detailed and comprehensive, so it may be more beneficial for people who are kind of organising PPIE. And we have things like training and development sections in it, and we also have sections on accessibility and disability. And one of the stars here is Katerina. Oh, sorry, Kat, for not pronouncing your last name properly. Kat, I saw this image on Instagram, this one at the side, and I absolutely love it. So I had to put it on the screen today. I love it. And we also have the guest, one of our highly esteemed guests in the toolkit is Tomas, the Greek in Ireland. So this is the dog here, and you'll see him on a couple of the pages. We also have different types of case studies and contributions. So this is one, a big data one that was from Sarah Stieg and colleagues. And Sarah looked at COVID-19 and self-harm during the pandemic and developed this infographic. So this is like a case study. Then we also have things on like research ethics and PPIE. So a lot of people get confused between involvement and participation. So some people are doing research and say they might do a focus group or an interview, and they think that they have involved people in their research then, and they haven't, they've just done research. So we talk a little bit about that and a little about ethics committees. Then we've also co-designed all these resources over the last few years, and maybe they will be useful for other people. If they are and you do want to use them, please feel free and just let us know, or please cite us. So this is a researcher PPI plans that Louise and the team developed, and this is for researchers to kind of, or PhD students or students to kind of get their head around how to even start involvement in their projects and their work. We have other resources that are freely available, including this co-designed wellbeing plan that Liz talked about earlier on. And then we have this ground rules document that we also developed together. And these are meant as I said, they're like just starting points and the tip of the iceberg for things that have emerged from our work. And I just want to say a quick shout out to all of the incredible people out there. And Isabella, I see you, and you totally should be on this as well for the fantastic involvement work that you've been doing as well. But there is some brilliant work happening in the UK. So I'm really privileged to also work on the Culture of Care program with Sal Smith is the lead of lived experience there, and she's just phenomenal. She's extraordinary, and there's resources that Sal's been involved in that are just superb. They're really good. And then we have Emma Nielsen, who's a pure star, and she's amazing. The work she's done, I've always been in awe of. Andrew Grundy is another outstanding lived experience researcher. He's brilliant. Ellie, who is out there in one of the little boxes, she is just spectacular at so many things, including roller skating. And she has done so much to transform services for people who have self-harmed. And then up in Edinburgh as well, Amy Chandler, Hazel Mazzetti, and other colleagues as well do some great work. So we're just a tiny little dot and trying to contribute our learning as well. But there's some brilliant work happening too. Okay, so in summary, I'm going to wrap up here. This is just my section. So patient and public involvement in self-harm and suicide. We know that it's essential and it's beneficial for everybody. We've developed resources, but they're only a starting point. They're only a starting point for people to create their own work. And as Liz said, for people to really own and adapt for themselves and to open up those conversations. Everybody's going to receive copies after the meeting, so we will email them out. And please let us know if you find them useful and if you're going to use them. And follow us on Twitter. So there's lots of different accounts from the Patient Safety Research Collaboration, and there's myself, and there's also NKish as well. And thank you very much. So this is the end of my